Vancouver is an excellent example, and Frankfurt in Germany and Sydney in Australia, all these places had some community leadership that established this, and the politicians came on somewhat reluctantly after it was shown. Hi, my name is Mark Tyndall. I'm at the University of Ottawa. I'm the head of infectious diseases there. I've been in that city for about a year and have been trying to get some enthusiasm and support to improve harm reduction, and that may include a supervised injection site. And supervised injection sites have really become the lightning rod of all harm reduction, and I think we all believe that they're a very important way to try and engage people in some kind of continuum of care. And the need in Ottawa is quite great in that people are still injecting dangerously, needles are still hard to find, enforcement seems to be quite overwhelming in that people are constantly harassed. Most people are in and out of jail, and it's kind of the situation that was in Vancouver a decade ago. And I think from all the things we've learned through Vancouver and other places with harm reduction, we don't need to repeat all the same mistakes, and many of the lessons that we learned from Vancouver and the research that was done really needs to be quickly implemented in other cities across Canada and not go through the same rigmarole. So my goal would be to really present the evidence, to organize community, have a stronger voice, and move quite quickly to opening a supervised injection site. I'm not naive in that there needs to be some support. I think the police can undermine things quite quickly, but at the end of the day, we don't really need their position. They're a position that they're totally supportive of this, and it's so important to position this as a health issue that we can take over as health professionals and people who know how to deal with people with addictions. And if for many people it's a first step of some kind of contact, we need a very low threshold, low barrier kind of facility that people go there with the intention of using their drugs and do not go there with the intention that they're going to talk to a nurse or any kind of health professional. But it's just a starting point for a lot of people. And I know one of the issues that I think we have to be careful of is to build up expectations that are unwarranted. So it's not as though somebody's going to be taken to a supervised injection site and that day talk to a nurse and get their abscess taken care of, get an HIV test and start on treatment if they're positive. I mean, this is we know that most people have got into this situation with their addiction over many, many years, and it probably is going to take many, many years for some of them to reduce their drug use or stop their drug use if they do it at all. And I think the people that I care most about and the people that are really caught up in the whole cycle of jail and addiction and disease are those with so many issues, other issues to deal with. And I think as a society, to me, it's crazy that those are the very people that we're penalizing. So by consistently throwing in jail and denying services, and I think denying clean needles to drug users and not giving them the opportunity to be as safe as they can when they're using their drugs is a huge issue that we need to, as a health community, really make clear that this is extremely important. And I think a supervised injection site in Ottawa would be an excellent first start.